Well, hello, everybody. Hey, here we are. Start or Sit, our podcast, weekly podcast that we talk about injured players in your fantasy football league. And that injury is going to do one of two things. They're either going to sit or they're going to be able to start. Here we are going into week 8. Again, as I mentioned last week, the NFL, boy, there's a lot of parity. I guess you call it parity. I mean, there's so many teams that are close. And it's been a good season so far. But it is football. It is a contact sport. And weekly there are injuries. And there might be an injury to your fantasy football player, and we're going to talk about, again, whether or not they're going to play this week or have to sit out. How you doing, Dr. Hawkins? Are you ready?
Yeah, I'm absolutely ready, Shannon. One thing I wanted to point out to everybody out there, you talked about it being a long season, and one of the interesting things we're seeing, in the NBA, they talk about load management, and they're kind of sitting people and resting them. I think we're seeing a lot of that now. These guys aren't playing their preseason, and they're coming in with these sort of nagging injuries. We'll touch on some of them today, but we're seeing a lot of guys sitting for longer than we typically expect them nowadays, and I think they're kind of trending in that direction of NBA players. So we'll see how this goes moving forward.
Well, you got an excellent point there. You make an excellent point, Dr. Hawkins. I mean, the season is, 16 games long plus playoffs. If you get in the playoffs, that is a long season, particularly in a sport that, these guys, these players are just amazing. But I don't know if you've ever been down on the field. I'm sure you have, but you listeners that never have been on the field at an NFL football game, this is high-speed stuff. These guys are big, strong, and fast. And I think I've heard sometimes a collision is equal to like a minor car wreck when a running back gets hit going through the line. It's amazing that they take it week in and week out. It is really amazing. So let's get going here. Let's start with Mike Williams, San Diego Chargers wide receiver. Man, they just got Keenan Allen back like last week, and there Williams goes down. It sounds like a high ankle sprain. What do you think about that?
Yeah, if anybody was watching that game, that was your very prototypical, bad lower extremity injury. He was getting tackled to the ground. The tackler basically was on his foot, so it had his foot pinned to the ground, and then it rotated above that. So we've talked before about sort of high ankle sprains where those two bones, the tibia and the fibula in the lower leg, sort of get split apart. And that's basically what happened. His foot rotated, and that you could just see that something had to give there. And I think the big concern was that he'd actually fractured it. It was such a high energy and high deformity injury. He couldn't put any weight on it, had to be helped off the sideline. Luckily, he didn't have a fracture, but it was a serious high ankle injury. And so he's definitely going to be a sit this week, and he'll probably be off of that completely for a couple of weeks. And it's going to be that dreaded soft tissue injury that sometimes it heals a little quicker than others. But I think, given his position, Shannon, it's going to be a slow recovery for Mike Williams. They're going to be hoping Keenan Allen is going to be able to step in.
Yeah, absolutely. Make an excellent point. Let's talk about that just briefly, maybe for our listeners. When you talk about a high ankle sprain versus a low ankle sprain, the low ankle sprain is obviously it's an injury that you have to heal, but it heals quicker because there's less tissue disruption. When you start torquing those bones, that fib, and you damage all that tissue that connects those two bones, as a high ankle sprain that's what it is. It just takes a lot of time. These things, this is a lot of time, depending on the severity. It's a 6-week, 8-week healing time. What are your thoughts on that ankle sprain based on the severity? You talk about 2 or 3 weeks, but could be longer maybe.
Yeah, I think you hit the nail on the head there, Shannon. I think it's going to be minimum 6 weeks for him, especially given the position that he plays. And I think even coming back from that, you don't expect he's going to be as productive in the beginning because it's going to take a lot of energy to push and to twist and come off of the ankle. So even if he's healed, his flexibility and stuff is going to take a little while to spring back as additionally.
Yeah, absolutely. So he's probably at least keep an eye on him. Again, he's a great athlete, but it's biology again. It could be 6 to 8 weeks with Mike Williams. Here's one, Breece Hall. We've seen this before. We've talked about it before. This is not a atypical injury in football, particularly in the running back position, but unfortunately, Breece Hall tore his ACL and has a minor meniscus injury. Season ending pretty much. That's how we look at it.
Yeah, it's the typical injury where we say, guess what? It's wait to see him till next year. If he does well and the meniscus injury is indeed minor, he might be somebody who's back around 9 months. They tend to go a little bit slower nowadays with some of these NFL players, and we've touched on a couple Baltimore running backs before, J.K. Dobbins and Gus Edwards, who were both coming off of big knee injuries a year ago, and each one was a good solid 12 months from their date of injury till they were back on the field playing in a regular game. So it's a bummer. Breece Hall was a solid producer for fantasy guys, and having an outstanding rookie season, really helping with a resurgence for the Jets. And unfortunately, he's completely out now, and hopefully, they've got a decent plan to back him up now. But he unfortunately, take him out of your lineup. If you've got a legacy league, you hold on to him because I think he'll be good in the future. But otherwise, look for somebody else.
Yeah, just real quick, he can return, and he can return good. This week, the Seattle Seahawks, our hometown Seattle Seahawks, take on the New York Giants, 6-1 New York Giants. Isn't that amazing? You say that, the 6-1 New York Giants, and Saquon Barkley. Yeah, he's from your hometown. He had an ACL. Was it last year and he's back this year? He's performing well.
Yeah, he's a year. I think he's 2 years out now.
Okay.
But when you look at him coming back, there was that concern. He wasn't super productive last year like people expected, and a lot of people thought, hey, this is the end of him being special. But it just goes to show you that even when these guys come back at 1 year, there's some neuromuscular retraining that has to go in, like that ability to jump and cut and move. And so that's where, there's some almost like remodeling process that goes on. They call something called neuroplasticity,
right.
Your ability of your brain to sort of like relearn how to do things. And he's a testament to, if you're patient, you can get all the way back and be as good as you were before.
Yeah, he's looking really good this season. That's amazing. Ezekiel Elliot, here's a guy, I've kind of watched him a little bit with the Cowboys, running back, obviously. He is, I don't know, is he just getting banged up a lot? And he got banged up last week. He got a knee contusion. Sounds like a direct helmet to the knee, and they call it a contusion. But how's he doing? What do you think? Is he just taking a lot of hits, and this knee contusion is going to keep him out at least a week or two?
Well, he's your classic running back who's been around a while. He's had some ups and downs with other injuries. He had a little bit of a weight issue a year ago, so he slimmed down, and I think that's helped him. I think he got lucky in this situation. He did take a helmet to the knee, kind of had a hyperextension injury. So the first thing you think of with those is, could he have maybe had a little bit of a PCL injury, a posterior cruciate ligament injury? Apparently not. It doesn't look like there was any damage inside the knee. And I think the good news is because he's slimmed down, and I think his cardiovascular, levels are better now. I think he really does better handling the workload. I think he'll be playing this week. I don't think you'll have to sit him.
Okay, don't worry about sitting him. But you bring up a good point. When you do get that direct hit and you do hyperextend that knee, when that joint goes beyond its normal motion, that's when you start getting these ligaments that are going to get strained or stressed or sprained, as they call it. But so he's pretty lucky. Hey, when you talk about a contusion, when you hit that kneecap potentially, not a lot of soft tissue around the kneecap. So are we talking about a deep bone bruise where that lining of that bone, that periosteum, is bruised? It's pretty painful.
Yeah, exactly. Periosteum's kind of like the skin on the surface of the bone, and it's very adherent to it. And so if you get some bleeding underneath that, that's a very, very painful thing. I always tell people, remember when you were a kid and you were like climbing on the monkey bars and you slipped and banged the front of your shin against the metal, bar. You were pretty miserable. You had a big old lump there. It was really uncomfortable to touch it. That's the prototypical sort of deep bone bruise with bleeding underneath the periosteum. So you hit that right, Shannon. I think it just depends on pain and discomfort. But like I said, I think he's done a good job with slimming down weight-wise, and I think that's going to help him be able to kind of push through this. He'll keep a pad probably on the front of his knee, but I think he'll be playing. Yeah.
Speaking of those monkey bars, when I hit my shin, I was out for a week off the monkey bars. I had to sit for a week just to get back on the monkey bars. So I remember those.
You you just didn't have great physical therapists back then to get you back quicker.
I don't know if I knew what physical therapy was back then. Michael Thomas, New Orleans Saints. This guy's been out since week 3. They're talking about him coming back here potentially week 8. He had a foot injury. I think we talked about him. It was not diagnosed as a Liz Frank, but it just takes time. His position, stopping, starting, cutting, twisting. You think he's going to be back this week?
Well, this one's a bit of a puzzle. They've been really nebulous about his injury. They really haven't localized it too well. But as we've touched on a bunch of the different ones, the Liz Frank injuries, the turf toes, there's a lot of motion and a lot of stress that goes through that midfoot and that forefoot for these wide receivers. And so he clearly has not been able to sort of push through whatever level he needs to be able to, to cut and to do that without discomfort. So I think they're getting to a point where, 5 weeks now of rest. We're almost at 6 weeks. I wouldn't be surprised if he's a game time decision again. They'll have him out there during warmups and just basically ask him how he feels. So if you're desperate, I would play him. But I have a feeling he still may have one more week of rest until he comes back after 6 weeks being out.
Yeah, in athletics, that foot, that foundation is pretty important. It's got to be completely healed so you can, just like you described, he's got to be able to perform, stop, start, cut, twist, and he's got to be safe in that environment. So he may go. You're saying, okay, here's one close to us here in the Northwest. Our friend DK Metcalf, I think he went out the first quarter of the game against the Chargers. I just saw him get on the cart. They said later on he had a knee injury. Then it came out a couple days later that he had, I believe, a patella tendon injury, but did not require surgery. So let's talk about DK Metcalf and that illustrious patella tendon.
Yeah, I wouldn't be surprised if he's been nursing, like a little bit of a mild patellar tendonitis issue, the classic sort of jumper's knee, just because of the position he plays and his size. So that's a situation where there's I guess the simple way to put it is a little bit of chronic irritation or like microscopic tearing where the tendon attaches to the bone right below the kneecap. And so a lot of high-level athletes have this. They have discomfort there. You'll see basketball players wearing a strap below their knee sometimes. And so my guess is he's had something like that. And then when he came down and had that sort of sudden jolt to his knee, the concern was, did he develop a macro tear, a larger tear there? And I think if they saw that on the MRI, that would have been the surgery that was indicated. But obviously, they probably just saw inflammation and said, yep, you probably just tweaked this thing that's been sort of smoldering there a little bit. I think he'll probably be out this week. Back to the idea that he's such a high-level athlete and requires a lot on his speed and his verticality. I think that'll be something they'll be careful with him because they don't want that issue to progress into something that would need surgery.
Yeah, it's like we talked earlier, this is a long season, and this is an injury that just, like we've talked about many times, just takes time to heal. But I mean, when you look at it, and I saw it on TV, and what you described is, I think you mentioned earlier on when we started talking about DK, you said jumper's knee, and this is a typical injury that is what we call in the business kind of an eccentric loading. That means he went up and he landed, and that loading and coming down, and that causes the body or those muscles to have to contract, but a lengthening contraction, and that sometimes is very stressful, and that's where it irritates that tendon. So it was one of those loading type injuries, i.e. jumper's knee. So infrapatellar tendonitis, probably not huge, but he is out. You're thinking he's out this week, probably back next week, most likely?
Yeah, I think that, hopefully they'll get his situation. Maybe Tyler Lockett can kind of step in and get his numbers back up a little bit. I know he's been a little bit on the on the low side of his normal production, but they've really got a great athlete there. So I think they'll just try to shift a little bit and give DK a week off.
Yeah. What do you think of? We just got to talk about him, I guess, as we've got some time here to wrap up. But just real quick, boy, Russell Wilson, man alive. I mean, I feel bad for Russell Wilson. I really do. He's had a tough season here. He's got this lat tear, and then he sits out last week because of a hamstring strain. It sounds like it's a low level injury, but they're sitting him out probably because it's mid-season. Let's keep him and get him healthy. But you think he's playing this weekend? Just out of curiosity.
I think that's a roll the dice situation. You know, they're not out of it based upon where they're sitting in their standings, but I think it's one of those situations where his age is catching up to him a little bit. He's been such a dynamic player for a long time, and sometimes those dynamic players, when they start to get some of these nagging injuries, it just starts to chip away at their foundation. Again, I got to be honest, Shannon. Do you know who they're playing this weekend? I don't know.
I don't know. I don't know who they're playing. I was just thinking about it as we were talking, so I really don't know. But you know, we talked about it earlier in the conversation here that it is a long season. It is an aggressive sport, and when you have these type of injuries, these soft tissue injuries, you got to let them heal because. I mean, if they don't let them heal, it's a nagging injury. And what I've noticed with Russell Wilson, I think what's been taken away from his game, maybe, you know, he doesn't seem to scramble and run as much as he used to. And I think that's just because he's probably prone to injuries just because he's been doing it so long. I mean, you just can't be prevented sometimes, right? So.
Right. He loses. I don't think he's got that base to pull off, off-axis throws like he used to.
Yeah,
so he can scramble and pull off those things like a young Mahomes can still does now.
Yeah. As we wrap up, great stuff, good information. I always enjoy talking to you so much about these injuries, and I hope our listeners out there are getting their lineups ready for this weekend, Week 8. How are your Eagles doing? Let's just talk real quick. How's your Philadelphia Eagles doing? Are they still undefeated? I can't even remember the game last week.
Yeah, they're still churning along, and right now I think it's probably split back in Philadelphia between the Phillies and the Eagles right now as far as who's most popular. So I think I think right now everybody's probably focused on Friday with the World Series starting, and then they'll move back into the NFL mode. But I've got a lot of friends back there who are very excited about baseball, and they're hoping obviously to take the Astros out and bring a World Series back to Philly.
Good luck to the Phillies. As we wrap up, thanks again for your time. Thanks for your information. Look forward to talking next week. And until then, have a good fantasy football weekend. We're out.